What is the, would you still classify us as in a pandemic, or is this now an endemic?
Hi, Chuck, and I'm glad to be here with you. Thank you so much. What I think we can say is that we're in a different phase of COVID-19. It's still a really important public health problem. As you've said, cases are going up. We're still seeing hundreds of deaths a day, thousands of hospitalizations a day. And it really needs to be taken seriously as a public health problem, and people need to do what they can to protect themselves, which is most importantly to get vaccinated, to get this the updated bivalent booster.
And the importance of the vaccine, right? It doesn't mean it's going to prevent you from getting COVID. And I know you know this and I know this, but I feel like we should reiterate it. The point of getting the vaccine is what, Dr. Mahon?
Well, the vaccines are really good at protecting against severe illness, hospitalization, death. They're not as good at protecting against just getting infected. But what we really care about is whether we get, meaningfully ill, hospitalized, have to go to the emergency department, and they protect really well against that. In fact, we just had 2 new scientific studies that just came out today showing that people who got the updated bivalent booster have only half of the hospitalization, the risk of getting hospitalized, or the risk of needing to go to the emergency department for COVID. So that's really meaningful protection, and people who haven't gotten this booster should get it as soon as they can.
Now, I want to talk about RSV because a lot of parents are concerned about this. In fact, in a Kaiser poll, more parents are worried about their children getting RSV than they are the flu or COVID. Are their fears correct that they should be more worried about their kids getting RSV?
Yeah, RSV is it's been around for a long time. This is not a new virus. It is the most common cause of hospitalization in kids. And so, yeah, especially for little kids, it does make sense to be, concerned about them getting it. For most kids, it isn't a serious illness, but for a significant number of children, maybe 1 or a couple % of children every year do get hospitalized for it. Almost all kids will get it by the time they're 2 years old. And what parents can do to protect their children is really just those everyday actions that you take to keep yourself safe, covering your cough, washing hands, staying home when sick, staying away from other people who are sick. Also, people have the option to wear a mask if they would like to, and we do recommend that. Not so much for RSV, but where COVID levels are high, we do recommend wearing a mask.
You know what? Let me ask you that basic. So a lot of people are going to be traveling. A lot of people are going to be going to big gatherings. Tell me how you walk around. Tell me when you wear a mask, when you don't, when you do. I think people want to know, what does a doctor do? What does a pediatrician do? What would you be doing?
Yeah, and I am a pediatrician, and I also have a 91-year-old father-in-law who sometimes lives with me. So I try to be careful, and I try to make good decisions. If I'm going to be in a large crowd, if I'm traveling, I will think about wearing a mask. When my father-in-law is staying with me, I'm much more likely to wear a mask if I go out into a crowded place than if he's not. I also, I can't emphasize the vaccines enough. I think that, I think people are really tired of hearing that you should get vaccinated, but this one is, it's really very effective, and I just, can't recommend it enough.
Why do you guys have a theory as to why, even though COVID cases are up, hospitalizations are up, deaths are up, that vaccinations for COVID are not?
Well, I think that people have pandemic fatigue and they have vaccine fatigue. And I understand that. I have pandemic fatigue and vaccine fatigue too. But knowing how effective these vaccines are, I think that, it seems like really clearly a good idea to get it, especially as you say, as we're heading into the winter season when, for the last 2 years, we've had really tough COVID winters. And that's also the time when the other respiratory viruses tend to go up as well. So, I get why people are are tired of having to think about it, but unfortunately, COVID isn't going away, and we do need to do what we can do to keep ourselves safe and to keep our loved ones safe.
Dr. Barbara Mahon, who's been working with the CDC on all of this, really appreciate you coming on and sharing your expertise with us. Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.